Hello and welcome to the 5th online meeting for the NHS formal public consultation called Modernising Health and Care Services in the Teignmouth and Dawlish area. First of all, slight apologies for coming in a little bit late. We had one or two technical issues that we're hopefully sorted out now. So what I'd like to do first is introduce myself. My name's Kevin Dixon. I'm a carer. I'm a member of my patient participation group, and I've been a volunteer working in the sort of South Devon area for the last 40 years. So I really know quite a few sort of local people and some of the voluntary groups that are here locally. My role in this is really to facilitate the following hour and a half, and also to progress and present your questions. And we're trying to get as many questions asked to the panel where we possibly can. So that's really my role. The other role I wanted to introduce was the role of Health Watch, which is an independent charity. We've been involved in health and social care over the last 6 years, and behind the scenes we've got a number of Health Watch staff and volunteers who are going to sort of progress this and sort of look at the questions that you are presenting to us. Let's see, first I'd like to do is to introduce my fellow panelists, and I don't know whether we've actually got a and there we are. I'll let them introduce themselves properly a little bit later. So and you know what they do, what their sort of job titles are. So the first panelist we have is Joe Turl, and then we have Liz Davenport, Dr. David Greenwell, and Dr. Carly Karakusevich. Now, thank you very much for that slide. What we're actually going to do this morning is, first of all, after my introduction, is we're going to look at a short video. Now, that video is going to be looking at the current model of care and the sort of health and wellbeing centre in Teignmouth. Then there will be a presentation by Dr. David Greenwell, who will be really sort of looking at the background of the proposal and the proposal itself. That will be followed up. We're trying to put as much time, opportunity as possible to get your questions in. So there'll be a question and answer session. And if I can ask panelists who will be listening to, because one or two people have said, let's stay away from things like jargon. And there will be what we want to do is really see how this format goes. This is a different format to what we're used to. And we did have plans to do lots of public meetings, but because of the current situation, that's slightly difficult. So this is how you can actually ask a question and post a comment. So everybody watching can ask questions or share their views by using the question and answer function in Microsoft Teams. And what you should see is an icon that shows a question mark in a speech bubble with another speech bubble behind it. So if you click that icon, it will bring up a panel where you can type a question. And what we'd really like to do is to encourage you to give us a name. You don't have to give your full name, obviously. So it just gives a nice idea of where you're actually coming from, because we want to get a very broad spread as much as we can. So for example, let's see. So if it was me, I would say Kevin, TQ12, so possibly put your first postcode in, or it might be the village you come from, the town you come from. So it could be, I don't know, Mary from Dawlish. And that gives a broad idea of who's actually out there. Of course, you can be anonymous if you like. That's not a problem at all. So when you've actually typed your question, you tap or click the paper aeroplane symbol and that'll send it to us. Behind the scenes, my independent Health Watch colleagues will then moderate the posts and we'll aim to publish as many as possible. What we found is we get a number of questions on the same topic, so we might try and sort of blend those together. You can also read the published comments and questions in the featured tab of the Q&A panel. And we'll talk about that a little bit later. And we've had a number of questions that have come up that we've got out and researched a little bit of an answer to them. We're aiming to publish as many of those questions as we can, and the posts are being checked to make sure there's nothing offensive or any information which would identify patients. That's the real reason why we're actually sort of trying to, get some of these questions together and put them to the panel. Now, please feel free to post any of those questions at any time. So if there's anything burning you want to, put it up there now, and that'll be much appreciated. And we'll come to them as part of the Q&A part of the question. So what we'll do now is just show a short video which explains how the current model of care works and how a health and wellbeing centre would further support it. So if I can ask colleagues to post that video, if possible.
My name is Matthew Fox. I'm a GP in Dawlish. I've been a GP for 20 years. I live in Teignmouth and I've been supporting the patients at Teignmouth and Dawlish for 20 years. I spend one day a week working for Torbay Hospital as part of their intermediate care team. Every weekday morning, Monday to Friday, we sit down as a group of professionals. So that's a GP, one of the GPs from the local practices. That's our community health team. It involves our occupational therapists, our physios, our community nurses, district nurses, our mental health team as well, and our voluntary sector. Our team isn't just statutory NHS services. Having the voluntary sector embedded in the same room at the same time gives us the potential to really support our whole community.
I'm the intermediate care and therapy lead here at Coastal. And we at the team here work towards ensuring that people in the community are kept safe and at home on a day-to-day basis. My role is very much to support the team in delivering that. So the value of having us all in one room at the same time is really helpful because it's beneficial to bring up not only the people that we discuss as part of intermediate care or in the community, is about the fact that you can bring anyone to the room, and because you've got a wealth of information there and you've got experts in all those different fields, all of us together are able to then figure out the best plan for that patient and on that day.
I'm the Community Services Manager for the coastal locality, so that means I'm responsible for the health and the social care teams that work out in the community to support people in their own homes staying as independent as possible. Enabling cross-working between voluntary sector, health, social care and primary care is absolutely vital in us being able to progress our services to the next level.
I'm the Community Nurse Manager for the coastal locality. My job involves overseeing the work of the community nurses and also the intermediate care nurses and the nurses that work in long-term conditions. So the aim is to have an oversight over the coastal locality of patient need and matching the right nurse to the right patient.
I'm Liam, one of the Coastal Health and Wellbeing Coordinators. Our main role is to deal with the incoming referrals via phone and telephone, liaise with all the patients, relatives and various departments to gather information for the team to assess what a patient's situation is like and what input they need from our team.
Traditionally, people have thought of medicine being you go and see your GP, if you're poorly you go to hospital, when you are better you go back home again. And the only place you could have your care was in a traditional hospital. The world has really moved on, and there's really good evidence that actually if you can support people in their own home, you can actually support more patients than you could just in a traditional hospital ward. So for us, integrated care is actually how do we bring all the parts of our system together to work more powerfully on behalf of our patients.
People in Teignmouth and Dawlish are being urged to have their say about the shape of future health and care services once a new £8 million health and wellbeing centre is built in the heart of Teignmouth. Torbay and South Devon NHS Foundation Trust is planning to build a state-of-the-art new health facility so that GP services, health and care and voluntary sector services can be brought together under one roof in the centre of town, providing seamless care for patients and carers.
To have a centre that is actually on the level in town, a designed building that we've all been involved with, will really enable us to join up the relationships and the understanding of each other's roles and the pressures on the different areas will really help that working in terms of how we link together to support clients going forward.
The Health and Wellbeing Centre would obviously be a new purpose-built building, so the room size would be government specified, there would be excellent access and good access for disabled people, which will be a considerable change to what we have now. I have been involved in the planning of this building for the last 4 years. We have had many meetings to discuss how it should be built, and we think the building we've come up with will provide everything that is needed to enable many multidisciplinary teams to work in the same building. So we'll be able to talk to social workers, occupational therapists, physiotherapists, pharmacists, and I think that will hugely improve the communication for all the healthcare in Teignmouth to the benefit of both patients and staff.
I think the really exciting thing about the combining all of our services in one place is that ability to communicate with one another. It's that sharing of one big room and that sharing of knowledge. By having your general practice and your voluntary sector and your care teams in the same place, you can't help but actually support those patients in at the best possible fashion. Almost think, well, why wouldn't you want them all to be working in the same place to give that sharing and support for each other?
You can find out more by visiting the Devon CCG website.
Right, thank you very much for that. I think what we'll do now is we'll go over to Dr. David Greenwell, and David will be really sort of explaining, I think, the proposition. So if I could pass over to Dr. Greenwell, and could I ask Dr. Greenwell to possibly explain his role, his background. One of the questions that came in earlier was, we just want to know where people actually come from. So Dr. Greenwell, can I pass over to you? Okay, there might be a few seconds while we sort out the technical issues on this one. Dr. Greenwell, can you hear me? Yes, thank you.
Okay, thank you very much. I hope everyone can hear me. Good morning. I'm Dr. David Greenwell, and I'm a GP in Torquay, and I'm the Southern Devon representative on the CCG board. First of all, I wanted to thank everyone who's taken the trouble to attend this webinar, and I really wanted to say that all your views and questions are really appreciated. Teignmouth and Dawlish have, over the last 4 years, become a national leader in developing a new way of looking after frail older people in their own homes. And the learning from your community is being exported not only to the rest of Devon, but also to many areas across the country with plenty of international interest. This community has effectively become the centre of the country for this new way of working that you've seen highlights of in the video. And this has meant that Teignmouth and Dawlish have changed the way that they work, and therefore the needs of the community have changed as well. So if we could look at the next slide, please. Thank you. So I'd really encourage you to look at some independent and academic reviews of the work that's going on here in your own community. Plymouth University have been studying the changes and comparing them with the rest of Devon, as well as with previous years' figures from Teignmouth and Dawlish. Some of the highlights of their findings include a 6% reduction in admission rates. And if you include the bed usage, in other words, the total number of bed days that were used, the changes are even more dramatic, because stays in hospital for Teignmouth and Dawlish patients have become much shorter. The other big change is that there are much higher uses of intermediate care in this area than the rest of Devon. And I think that that's simply because the GPs have come to trust the intermediate care system to provide effective care and to effectively keep people out of hospital. Now, it's really important to remember that keeping people out of hospital is really important as you get older and more frail. There have been a number of studies that have measured harm that comes to people with long hospital stays when you're older, particularly loss of muscle mass, decline in mental functioning, as well as other measurable physiological changes. So we should be aiming for really short, focused hospital admissions, getting people home as soon as possible. And one of the other things that Plymouth University measured was the degree to which people feel in control of their own health, something we call the patient activation measure, or PAM. And on average, this improved by about 24% in those people who went through the intermediate care system rather than a more traditional, longer hospital admission. And finally, in terms of the evidence, I draw your attention to the drop in the number of people needing residential and nursing care home placements long term. That's dropped by about 10%, which is really good evidence that the new system is delivering effective rehabilitation that's allowing people to stay in their own homes rather than having to go into residential care. The new model of care that we've been talking about has also been independently reviewed by a body called the South West Clinical Senate. Now, they're an independent body of senior health and social care clinicians, and they found our proposals and our new system to be a sound way of working. So if we could have the next slide, please. Secondly, the second reason for change is to do with general practice. Now, the hard-working GPs in your town practice from some deteriorating and in many cases inadequate buildings that, because of their age, can't be made fully accessible for disabled people. But the biggest challenge for general practice at the moment, particularly outside major cities, is recruitment. If the GPs had more space, better facilities, and better disabled access, it would be easier to train more GPs locally and to create an environment they want to stay in long term. We've certainly found that once GPs come down here and experience life in South Devon, they tend to stay long term. So a health and wellbeing centre will provide purpose-built GP facilities co-located with the health and social care team on a town centre level site, easily accessible by public transport. Okay, and the next slide, please. So our third reason for change is the need to make the most of our local community NHS estate and provide value for money. Teignmouth Community Hospital is in need of a great deal of spending to bring it up to modern standards. Privacy, disabled access, engineering, they all need major work, which has been costed at about £1.5 million. Running costs of an old building are also much higher than a modern one, and we believe the running costs of the Health and Wellbeing Centre would be at least £100,000 a year cheaper than that for the community hospital. And the day case procedures room is also not up to modern standards. And even if we invested money in it, the physical space is not large enough to meet modern needs. Dawlish Community Hospital, on the other hand, is a modern building with spare space. The new Health and Wellbeing Centre would give us modern accommodation for services. And the next slide, please. So, fourthly, our plans reflect not just what we've done here in South Devon, but national and local strategy for modern healthcare delivery. And we know that Teignmouth and Dawlish are leaders in this area. There's a huge benefit from putting GPs, social care, community services and the voluntary sector under the same roof. We mustn't underestimate the benefit to care from unscheduled meetings and the ability to seek rapid advice during the day. So let's move on to the next slide, please. So this is not the first time we've talked to you about our plans to move to this new model of care. And listed on the slides are the times and the ways in which we've previously consulted, starting back in 2013. And this is just a continuation. This process today is just a continuation of that. So what's our vision for the future? Let's have a look at the next slide. So building on the reasons for change and taking what people have told us over the years, a vision's been developed by the local NHS partners, including GPs, commissioners, and the Torbay and South Devon NHS Foundation Trust. And our vision is to build on the success so far of integrated services, what we've already seen in the video, to ensure the sustainability of primary care in Teignmouth, to help people stay well and support them when they need help, and to enable people to stay at home for as long as possible. Okay, and the next slide, please. So to deliver this vision, we're going to develop a new health and wellbeing centre in the heart of Teignmouth. This will bring together Channel View Medical Group, the health and wellbeing team, volunteering in health in a single accessible building. It'll provide further opportunities to integrate our services, as well as offering more space so other services can be included on a drop-in basis. It'll be a great place to work, a modern, bright, sustainable building, which will be an attractive proposition for new GP recruits. The development of the Health and Wellbeing Centre gives us an opportunity to consider where best to relocate the other services that we currently provide in Teignmouth Community Hospital. So this is the formal bit, and if we could have the next slide, please. This is our proposals for public consultation, and essentially there's a single proposal elements. Now, if the proposals were approved, Teignmouth Community Hospital would no longer be needed and would likely be sold to generate funds to reinvest in the local NHS. So if we could have the next slide, please. So element A of this proposal would be to move high-use community clinics from Teignmouth Community Hospital to the Health and Wellbeing Centre. These community clinics are audiology, physiotherapy and podiatry. Most people who use these community clinics live in Dawlish and Teignmouth in the area. Overall, these community clinics make up about 3/4 of all outpatient appointments currently held at Teignmouth Community Hospital, about 3/4. We're also proposing to move the ear, nose and throat outpatient appointments to the new Health and Wellbeing Centre so that they can be co-located with audiology. Okay, next slide. Element B would be to move specialist outpatient clinics from Teignmouth Community Hospital to Dawlish Community Hospital, 4 miles away. Now these specialist clinics, 23 in number, and they're listed on the right hand side of the slide, they make up only about 1/4 of the total appointments that go on in Teignmouth Community Hospital. They're also clinics that are less likely to need regular attendance. And about 70% of the people who use those clinics come from outside the Dawlish and Teignmouth area, so they're not clinics that are principally used by local people. They're people from all over South Devon use those clinics. Dawlish Community Hospital has got spare space and can accommodate these clinics, which would be relocated from Teignmouth. It's important to say that we're not proposing any change to the days or times or the frequency of the clinics that are moving. It's purely a relocation. Okay, element C, next slide please. The proposal, element C, is to move the day case procedures room from Teignmouth Community Hospital to Dawlish Community Hospital. And these minor procedures tend to be in 3 main specialties: oral surgery, pain management, and the largest of them is actually plastic surgery. And again, it's important to understand that people come from across South Devon and Torbay for these appointments. So this is not essentially a local service. only about 14% of those procedures would be done on people from within Teignmouth and Dawlish. The rest would be people coming from across South Devon. You can see on the slide what the room looks like at Teignmouth Community Hospital, and you can see that it really is too small for purpose nowadays. There would need to be an investment on the day case procedure room at Dawlish Community Hospital, and the suggestion is that would be of the order of £360,000 investment in Dawlish Hospital. So element D, and the next slide please. Element D is really to continue with the model of community-based intermediate care that I've been describing up to now, and reverse the decision to establish 12 rehabilitation beds in Teignmouth Community Hospital. Now, I wanted to explain what these beds were intended for. They were not medical beds. They're not hospital beds in the traditional sense. Rehabilitation beds would have been staffed by physiotherapists or occupational therapists and healthcare assistants. The beds were intended to provide rehabilitation to allow people to regain independence after a period of illness. But on reviewing the evidence, patients are much more likely to regain independence if the support happens in their own home and we don't prolong the period of institutionalisation that occurs when people are in a hospital. It's also worth saying that the team of community physios, OTs and support workers that works in intermediate care and rehabilitation in the community is able to look after about 4 times as many people at any one time as they would if they were looking after an inpatient unit. And therefore, not only is rehabilitation at home better, but we can provide it to 4 times as many people than we could if we reopened the beds at Teignmouth Community Hospital. Okay, can we have the next slide, please? So just to recap, one proposal, 4 elements. Move the high-use community clinics from Teignmouth Community Hospital to the Health and Wellbeing Centre in Teignmouth. Move specialist outpatient clinics from Teignmouth Community Hospital to Dawlish Community Hospital. Move day case procedures from Teignmouth Community Hospital to Dawlish Community Hospital. And finally, continue with the model of community-based intermediate care, reversing the decision to establish 12 rehabilitation beds in Teignmouth Community Hospital. Now, before I finish, we were quite sure that people would want to ask about how this decision related to COVID-19. And I wanted to say a few things about that at the end. Firstly, we do have a robust surge plan for use in the event of significant COVID admissions. We have the use of the Nightingale Hospital in Exeter for acutely unwell COVID-19 patients who may need oxygen. We also have a number of other community hospitals that could be used to provide beds for recovering patients if needed. Unfortunately, Teignmouth Community Hospital is not suitable for patients with or recovering from COVID-19, as it doesn't have oxygen facilities and its design makes the required infection control very difficult. Just to say also, the Health and Wellbeing Centre and Dawlish Community Hospital are both suitable to deliver services while meeting social distancing and infection control requirements. Okay, and the next slide, please. So on this slide, you can see details of how you can get involved in this consultation. There are lots of different ways to give us feedback. We'd love to hear your questions immediately after I've finished talking and I've handed back to Kevin. But if you'd like to send us feedback or comments in a different way, there's a list of ways that you can get involved on the screen, and I suspect at the end of the meeting we'll be able to put that back up again. So thank you very much all of you for listening, and I'm now going to hand you back to our chair.
Okay, thank you very much, Dr. Greenwell, for that presentation. Now, this is where we move on to the question and answer session. I've already had a number of questions come in, which is terrific. Keep sending them. If you want follow-up questions, please do. We'll try and answer as many as we possibly can. So we're going to address every topic and question which is relevant to the consultation. When questions do repeat a previous one, or one or more is received on the same subject, we might be using sort of one answer in response to several separate questions, so just bear that one in mind. If it's not possible to address a particular topic during the meeting, then we will let you know, and the CCG will respond in the frequently asked questions section of the website. So questions are coming in, and there's a number of those same really important topics that are coming in. So, and there might be some questions where it might be down to statistics or something that that folks haven't actually got access to immediately. So we'll follow up on that one. And the thing I'd like to do now is to move on to introduce our panel for today, and if I could ask the panel members to introduce themselves. And one of the questions that came in before is, could you actually explain a little bit about your job title and your remit, so it just gives you an idea. So if I could pass on to the panel.
Okay. Hi, hello everyone. My name's Jo Turl. I'm the Director of Commissioning for Devon's Clinical Commissioning Group for out of hospital services. So that includes planning and buying and then monitoring the services for all out of hospitals. That includes primary care, community services, and also mental health services as well.
Thank you, Jo. Next panel member.
Thank you. Good afternoon, everyone. My name's Liz Davenport and I'm the Chief Executive of Torbay and South Devon Foundation Trust. Thank you.
Thank you, Liz. Next panel member.
And my name is Carly Karakasevich. I'm a GP partner at Channelview Medical Group. I've been a GP in Teignmouth for 27 years and one of the GPs from the practices who collectively have been working at trying to find solutions for our improved services and improved premises for a number of years now.
And you've just spoken to, you've just seen David. So David, do you want to say anything? Was it? Can you hear me? No, I don't think David can. So we'll come back. Anyway, you've already met sort of David there. So right, we have a number of questions that already come in, and the first question is from Helen. Hi, Helen. I think we met. Who is, quote, interested that the travel survey shows over 60% of specialist clinic users said they would find it difficult to get to Dawlish, and 44% of community clinic users said the same, with very few saying it would be easier. That seems very clear. What further details are you hoping for from this consultation? And if I can direct that first question, Jo.
Yes, thank you, Kevin. Yes, it's a really good question. Thank you, Helen. I think there's probably a couple important things to say. The first thing to say is that when we obviously going through and engaging with the public on this, we undertook an assessment of what we thought the impact would be on all the current users of the clinic. I think the important thing to say is, so as it says within the documentation, significant number of people, in fact the majority of people who use those specialist clinics, which we're proposing will move to Dawlish, don't live in the Teignmouth area. So actually it's quite a small proportion of people that actually live within Teignmouth. There will be an impact on some people though. The maximum impact though will be 4 miles. So basically the difference between currently where they are and the proposed new site in Dawlish. It is also important to say though that of course this isn't the only factor that we're looking at. It's really important that we understand the whole impact of this on the population, and particularly the benefits that we think we'll get in terms of being able to co-locate those services. So it is one factor, but it isn't the only factor. And I would encourage people, as you're filling in obviously the feedback, to be really clear and open about what you think the impacts of that might be for you as an individual.
Right, thank you, Jo. And I would say to any panel member, if they do want to sort of join in on this one, just wave at me and I'll bring you in. Right, thank you. Next question, and this is anonymous, and the question is, this has come up as the panel would realise a number of times. Where is the car parking to use the new facilities? Teignmouth is difficult to park in at the best times, let alone in the summer. Bearing in mind one car park is already being taken over by a hotel, I am concerned where people will park. Can I ask Liz?
You can. Thank you, Kevin. And you're right. We've had a number of comments around parking. I think we do in any kind of healthcare conversation we have. I think one of the main reasons, one of the many reasons, I guess, of having the Health and Wellbeing Centre in the centre of town is it affords us a real opportunity in terms of access to public transport. So that was one of the benefits, and we know that there is good access into the town. We know that's not going to work for everyone. One of the other bits of feedback we've had from members of the public in previous sessions is the importance of having other facilities made available, particularly for people that might want to use bicycles for so that they have safe storage of bicycles on site. And I guess from a health and wellbeing perspective, that's also equally encouraged. We do work very closely with the council to make sure that we are optimising whatever car parking space is available in the town. We know there's some car parks and there is on-street parking, but we need to be clear that there isn't an option of building new car parking with the Health and Wellbeing Centre. Thank you for your comments. It's well made.
Thank you very much for that, Liz. Question 3, and from Helen. Quote, why was only the option of closing the hospital and moving the clinics fully costed and offered for scrutiny? It isn't possible from the figures available to directly compare the costs of refurbishing or rebuilding the hospital. Joe, I think this one's for you.
Yes, thank you, Kevin. I think first thing to say is that we did look at several options before we got to this point, and we did cost out various of those options. You heard in the presentation from David the cost that we think it would take to refurb the current Teignmouth Community Hospital just for the existing services that are there, but also the ongoing maintenance of that. So I think an additional 100,000 every year. So what we'll do is we'll put a link to the document within the question area there. But the options that we did consider were either keeping the community clinics where they were, or moving them to a new health and wellbeing site, which is of course what we're proposing today. The options that we looked at around specialist clinics and day cases were either keeping them on the existing site, moving them to the Dawlish Hospital site, moving them to Newton Abbot Community Hospital, or to Torbay. There was a standard set of criteria with which we looked at all of those options. Finance wasn't the only option, so we looked at things like finance, like travel distance, like the state of the current sort of facilities, whether there was enough estate there for them, and also I think really significantly for us was about integrating services. So it really needed to be an option whereby we could see services come together for the benefit of the population.
Right, thank you there, Joe. Let's see, another one from Helen. How will closing the hospital make it easier for statutory and non-statutory services to work together? The second part of the question is, why is it necessary for the GP centre to be opened? And Carly, fancy that one.
Thank you very much for the question, Helen. I'll answer the two parts separately. It's not so much about closing the hospital to make it easier for services to come together, but sharing a building we feel is very important. Over a long period of time as a GP, work has changed. Initially, as in the presentation and the video, it was described that general practice was very much about having GPs and very small number of teams around them. Increasingly, we have broader and broader teams within our own GP surgeries, a range of different trained nurses, some physiotherapists, possibly joining in future, pharmacists already, social prescribers and so on. So the team is much, much broader. But if, for example, if I had complex health needs, it's very likely I'll need an even bigger team to look after me. And that team would include health and social care from the community. This is where I'm about to get pulled up by Kevin for talking jargon, so I'll correct myself before I go further. So what I'm talking about in general practice are GPs and nurses and the sorts of health professionals everyone will be used to seeing. The community health team are physiotherapists, district nurses, occupational therapists in the main. And the care team are the social care support that are required around that. Now, if I was someone who was particularly elderly and frail, I'm very likely to need support from all of those elements, and not all of them at the same time, but a mix of those people. And very frequently, additional support from the voluntary sector. Now, we've mentioned volunteering in health as one of those teams, but there are, as Kevin has alluded to, many different voluntary organisations in Teignmouth and Dawlish who support people extremely well to maintain their own health and independence. By bringing as many of those elements into one building, we feel very strongly that there'll be a much greater understanding of each other's roles, a much improved line of communication, both formally and those ad hoc conversations, and ultimately that will mean better services for our patients. And I know it does sound rather strange in the times of a pandemic when we're having to socially distance, and for example, we're having to do this virtually instead of being able to have normal face-to-face conversations. But there will be a time in the future where we can have those corridor conversations again and the face-to-face communications, which will be vastly preferable to having the phone calls and the virtual meetings that we're having to do now. So that answers the first part. Why is it necessary for a GP centre to be open? It's not so much as a GP centre. I think it is really important that we view this as the health and wellbeing centre because it has all those extra elements. It isn't just about GPs, and the benefit of the improved services will apply to all the patients, everyone who lives in Coastal. So that doesn't matter if you're registered with Channelview Medical Group, another practice in Teignmouth, or the practice in Dawlish. The services will be the same. And I think David's already covered in the presentation a description of why we need new buildings, because our buildings are small and cramped. So I won't make this answer any longer and go into that again, but I can if you wish.
Okay, thank you, Carly. And as I said, anybody that wants a follow-up question, please send those questions in. Right, and this is from Larry. Quote, from previous meetings, it seems that the local care homes are going to be required to do a lot of heavy lifting, but most of them aren't fit for purpose and have failed CQC inspections. Can we have any faith whatsoever that vast improvements will be carried out to make these facilities fit for purpose and not the antiquated rabbit warrens most of them currently are? Oh, this is a big one. Liz first and then possibly Joe?
Yeah. Thank you, Kevin. So I'll say a bit. Thank you, Larry, for your question, and I will hand on to Joe, who I know has been doing a lot of work with Devon County Council about future planning. So I think the first thing I would say is that our core focus is on supporting people wherever it's possible to enable them to receive their care at home. And we've seen from the work that the intermediate care team and the wider team has done is that we've seen a significant reduction in the number of people who go into care homes. Having said that, they've got a really important part to play, whether it's to provide short-term support to enable people to go home or longer-term support. And our teams based locally work really closely with those care homes to make sure that they have advice and support and training to enable them to maintain and build the quality of their services. And where we have identified quality concerns, we've been able to work collectively with them to sort those issues out. And I note in your question, Larry, about most homes having failed the CQC inspections. I have to say that's not something I would recognise. I know one of the homes about 18 months ago had some challenges, but it's not a current experience for us. We continue to work very closely and work with them to provide really high quality care in those environments. But Joe, I wonder if you could just say something about the future stuff that's going on in terms of long-term planning.
Yes, thank you, Liz. Yeah, just to build on what you've said about current state of care homes. So actually, if you look at the care homes that Devon County Council commission across the board, actually, they commission and we as NHS partners as well commission a significantly high amount of good and outstanding care homes. So actually, we've got some really good providers locally. So our team, so our commissioning team, who look at what services we will need in the future, have been working really closely with our social care colleagues in Devon County Council, and we've undertaken what we would call a piece of demand and capacity analysis. So what that basically means is we look at what the future need will be over the next 5 to 10 years versus what we've currently got. So we know what we've currently got, what we currently need, and we also know what we think we will need in the future as well. So the work that we're doing with our commissioning colleagues is how do we get from where we are now to making sure we're foolproof into 5 to 10 years in the future. We've done some really good work actually recently across Devon around learning disability care homes, and actually through doing that work and through talking to providers in the market, bringing new providers into the local market, we've got some really good care homes locally. So we're going to build on the work that we've been doing there, and we'll be talking to existing providers and new providers about what we want to commission for the future.
Okay, thank you, panel, and thanks, Diary, for that one. That's very interesting. Right, this one's from Pauline. Community health and care and voluntary services are all functioning well under one hospital and roof already. Why not spend this money on upgrading and maintaining current facilities instead of splitting them between Dawlish and the yet to be built premises? And I think that's Joe again.
Thanks, Kevin. Yeah, I mean, I'm not going to repeat some of what Carly talked about earlier on, but I think the main thing for this to me is yes, services are working really well together, but it's about how we make that better for the future. And I think and as Carly's referenced, by bringing primary care together with some of those community clinics and with the voluntary sector, all under one roof in a place where actually the population of Teignmouth has told us actually this is where we want that health and wellbeing centre to be sited. We think that will deliver much better benefits for the future. And it's not just, I think the important thing is here, it's not just about the finance. So there are other factors, really important factors that we need to consider.
Okay, thank you for that. From Helen, when you say stays in hospital, do you mean both acute and community hospital beds taken together? Because they were very different outcomes. One is part of planned community care and one is a breakdown in community care. So can you clarify, because this is an important point, and it is, and Liz?
Thank you very much, and thank you, Helen, for your question. So you're right, we have different sorts of services depending on the needs of individuals, and our modelling confirms that we have, when people need a bed will be made available. So our acute hospital is there to provide care for people who need 24 hours, 7-day acute hospital care, and they're great environments to deliver that care. But we also know that staying in hospital longer than you need can actually be disadvantageous to people's health and well-being. So we actively encourage people to go home as soon as they possibly can. For some people, that might mean that they need a short period of ongoing rehabilitation in one of our community hospitals, where they would remain again with access to nursing, medical and therapy care as part of their treatment programme, and again, wherever possible, supported to go home. We do have circumstances where people are admitted to our community hospitals as an alternative to come into the acute hospital, but that is not because there's been a breakdown, but it's because it's about providing the most appropriate care for that individual at that point in their recovery journey. So that is the main reason why we use the hospital beds in those ways. And I think what we've seen, and I think David spoke in his presentation about the real advantages in supporting people at home and the better outcomes as a consequence of that. People report that their health and well-being is better. They also tell us that they feel more confident in managing their own health and well-being. And that is why we believe that, that it's important that we support people at home wherever possible. Thank you.
Right, thank you there. And this next one's from Ray. Quote, at this time of the pandemic, we mentioned the pandemic a little bit earlier, with huge uncertainty about our ability to respond to a second wave of the virus and a clear need to have as much available hospital capacity as possible, how can you even consider holding this public consultation now with a view to closing the hospital? Probably Liz? Liz? I don't think we can hear you, Liz. Are you muted yourself?
Apologies, I've muted myself. It's the first time I've done that. Apologies. Thank you, Ray, for your question. And it is very much in people's minds, isn't it? Particularly with the increase in infections nationally. It is really good to know that the Southwest continues to see the lowest incidence of infection, but clearly something that we're all really worried about. I'm just going to reiterate something that David said in his presentation earlier. We have been working really closely to make sure that we understand what the likely demand for hospital beds will be as a result of the pandemic, and have really well worked through escalation or surge plans, as they get called in the health service. And those that surge plan needs to take account of the fact that different people will need different things. But what we do need to have is make sure that we have minimum standards of access to things like oxygen, and for the most seriously unwell, ventilated beds. We've seen that Nightingale Hospital be built locally, which is a real asset to us, because that means that we have much greater flexibility to respond to local needs and support our acute hospitals. We've also modelled what we might need in terms of support for people to recover, and we've identified that we can increase the level of community hospital beds should we need to do so. But I would say that they have to be in environments that are able to support the specific healthcare needs of people recovering for COVID, which includes access to oxygen, which are available in some of our community hospitals. But I can assure you that we have modelled it, and we are confident that we have the level of capacity needed for all people as a result of the pandemic.
Okay, thank you there, Liz. Right, one from Pauline. Straightforward question: why not build a much smaller doctor's surgery in town to their requirements only? Just perhaps save some well-needed parking spaces. This would allow the hospital to be brought up to date and still cost less than the 8 million available. Carly, this one for you, I think.
I think I'll answer the first bit, and I might need to bring Joe or Liz on for the second part. I think I see Pauline's point entirely, and that while having a new but smaller building for GP surgery only would answer some of the difficulties we currently face with cramped space and antiquated buildings. But I think this would be a huge missed opportunity if we don't at the same point look at the options we have and bring other teams together, as I referred to in my previous answer. So I think it would answer some of the current conundrums, but it would be a missed opportunity and not let us build on the brilliant working relationships we currently have with our health and social care teams. So if I could then pass over to Joe back the finance side of things, please.
Yeah, sure. Thank you, Carly. I think the important point is the one you make about the missed opportunity, isn't it? Just on the finances, though, what I would say is I don't think we know that it would be less expensive to do that. So we've already heard about a significant amount of money that would need to be invested into Teignmouth Hospital, and then the ongoing maintenance of Teignmouth Hospital, which is significant. And building a new GP practice big enough to house, for the population of Teignmouth will also be, it will be a significant cost. And actually, what we've been able to do by bringing those services together in one building is actually be more efficient with the space. So things like shared areas, reception, etc. So actually, I'm not convinced it would be any more cost effective to do it separately either.
Okay, thank you. Right, another one from Helen. This is probably to Liz again. So can you reference the source of the figure of 10% reduction in use of long-term residential care in the locality? And the follow-up is it anything to do with the shortage of care beds? Liz?
Thank you, and thank you, Helen. That's an important area, and I know it's something that people are concerned about. I suppose my response would be we've been working really closely with people in their own homes. We've taken what we call a strengths-based approach, really supporting people to remain independent at home with support as necessary for as long as possible. And we know as a consequence of that, more people have been able to remain at home and fewer people have needed to go into long-term care. So if we just look at the data of the number of people who have been admitted into those homes over the last 2 years, we've seen that reduction year on year. And I think that just really reflects the model that we have been putting in place. Like all services, we do get peaks in demand, but we've been able to work really flexibly to make sure that if there is a need for people to receive bed-based care, including going into care home, we are able to meet that need, but not where, what we are aiming to continue to do is to support people to remain at home where it's safe and appropriate for them to do so. Hopefully that helps answer your question, Helen. Thank you.
Right, and I know David mentioned this a little bit in his presentation earlier, and the next question was, what were the outcomes of the previous consultations? Jo?
Yeah, thank you, Kevin. Yes, so CCG has been involved in a series of presentations, really, certainly since I've been working in South Devon and Torbay and wider Devon as well. So we've probably not got time to go into all of that now, but what I would suggest is we'll pop an email address into the Q&A section, and that will be an email address which will go to Healthwatch, and they'll be able to answer any questions in terms of outcomes of previous consultations for you.
Okay, thank you. This is from Gordon, Bishop Stainton. The only reason that Teignmouth Hospital needs so much refurbishment is because it has been allowed to decline, possibly deliberately to provide ammunition for its demolition. There's seemingly a lot of manipulation going on behind the scenes to ensure that the CCG get their determined outcome. I'll throw that out open to everybody on the panel, but Liz.
Yeah, thank you, and thank you, Gordon. And I think we all understand as a panel that Teignmouth Hospital has served the community well over a significant number of years and is valued by the local community. We have continued as an NHS trust to continue to keep up the building over a good number of years, but we are required to do so and have regular checks to make sure that we're compliant with the minimum standards. The reality is, though, as we move forward and think about not just delivering care now, but in the medium and long-term future, the environments that are provided in Teignmouth Hospital are no longer the best environments to deliver care for the future. And if we're going to invest money in services, it's our responsibility to make sure that we do so in a way that protects the health and care services for the populations, not just now, but into the longer term future. And in terms of ammunition for demolition, I think it's really important to say that there are no plans for Teignmouth Hospital at the current point. We are here to consult on the future model of services, which may have an impact on the future of Teignmouth Hospital, but we're not. There's no plan for Teignmouth Hospital as we currently are here today. Thank you.
Okay, unless anybody wants to pick that one up, I'll move on. This is from Ray Ashman. Hi, Ray. Can we have a guarantee that the proceeds of the sale of the hospital would be ring-fenced for the local NHS? Possibly you, Liz?
I'll keep my microphone on. I get lots of questions at the moment. Thank you, Ray. So just a simple answer. So depending on the outcome of the consultation, and I think it's important that we acknowledge that, if the event is that services are moved to other premises and therefore it is empty, the NHS would seek to sell the building, but there's no current plan to do so. And if so, that money would be used to reinvest in capital for health and care services for the local system, and by that the Torbay and South Devon system. Thank you. Okay,
that's fairly straightforward. Right, one from Pauline. Dr. Fox has said that all services will be working together in the one building. They won't. They'll still be split between Dawlish and Teignmouth instead of between Teignmouth and Teignmouth. What is the advantage? Oh, Carly?
Yeah, no, absolutely happy to answer that. From the GP angle, and either Liz or Jo can join in if they feel I've missed something out. I think the important bit about this split is that the proposal is that the Health and Wellbeing Centre will have GP services, the community team, so that's the Health and Wellbeing team, which is broadly the office-based bit of the community services of district nurses, occupational therapists and physiotherapists, but the physical provision for the high-use community clinics, as I understand it, which are things like physiotherapy, audiology, podiatry, those sorts of things. And I won't have given the full list, I'm afraid, because it's not. I don't think I'm reciting the whole bit, and Liz will come in on that. The services that will be based in Dawlish are the specialist outpatients. So that's the sort of thing where a patient of mine will go to see a consultant for an appointment, maybe for a follow-up from a hospital admission, or for ongoing maintenance outpatients, which may be a 4-monthly, a 6-monthly, an annual appointment. And those were the list of many different clinics, for example, orthopedics, gynecology, those kinds of things that were on David's presentation. And I think I should probably pass over to Liz at that point.
Thank you, Carly. So actually you got most of them right. So the high volume clinics, actually over 70% of the clinics that are currently run at Teignmouth Hospital would be based, it's proposed will be based in the Health and Wellbeing Centre. So it is like physio, podiatry, audiology, and also because of the link between audiology and ear, nose and throat treatment, we also will be including the ear, nose and throat ENT clinics at the Health and Wellbeing Centre. The balance of those clinics, just about over 25%, will be run at the Dawlish Clinic, and they'll be run at the same times, same frequency as they're currently run in Teignmouth. But what they will be is in their environments that are more fit for purpose, and that's particularly important for the procedure rooms that needs to be updated to meet current up-to-date standards. Finally, I would just say, only about 14% of the people who attend those outpatients appointments at Teignmouth Hospital actually come from the local area, and people come from Torbay and other parts of South Devon. So hopefully that just gives you some reassurance around the likely impact.
Okay, thank you. Next one was from Sholden, Shirley in Sholden. This is a consultation, so what are the real chances of our views and concerns resulting in substantive changes to the plans and proposals? My view would be the Wellbeing Centre concept is good. Somewhere that isn't going to be at risk of flooding would be better. That's another thing we haven't touched on. But losing the hospital would be reckless, especially with COVID running riot. And Joe?
Yeah, thank you, Kevin. Yeah, no, it's a really good question, and I might ask Liz in a second just to comment on the bit about the flooding, but in terms of what's the opportunity of having your views and concerns heard, I mean that's what we're all here for today. This is our 5th out of 6 of these, plus everyone in the area has received a consultation document and opportunity to comment. So I just urge you to do that. Obviously, you're supporting here by putting your comments and questions to us. We'll collect all of that. Again, just would encourage people to fill out as well those consultation questionnaires and post them back to us. There will be, when we finish this consultation period, there will be a period of time then that we've got set aside to go through all of the feedback, and we will evaluate any other suggestions that have come forward as well against the criteria to understand if there's anything we can improve upon, anything we can do differently. So I would really encourage you to do that. Just the bit about the losing the hospital. I mean, David covered it a little bit earlier on in terms of the hospital not being fit for purpose, and particularly to support patients with COVID, but also just to remember that. So even when we come to the end of this period of consultation, and if we decide to go ahead with the proposals that we've got here, of course we won't be losing the hospital instantly. As Liz has already said, this is about the proposal around services and where those services are best placed, but no services will move until they're ready to do so. So actually the Teignmouth Hospital in its sort of current form, if you like, will be here for a little while to come as well. I think it's important to remember.
Excellent, thank you. Now the next one. Oh, sorry.
Did you want me to pick up on the flooding issue? Yeah. I think Joe neatly handed that to me. So again, there is an issue, isn't there, in the centre of Teignmouth overall in terms of flooding. But I am reassured by our team that are working very closely with planning departments that the design is being put in place to mitigate those risks, to make sure that we manage that as effectively as possible. So hopefully that gives you some reassurance. And we've got a great relationship with the planning department, and we're working very closely with them to make sure that in taking this forward, we take account of our broad range of interests in the local community.
Excellent, thank you. Right, the next one is a comment rather than a question, and it's from Malcolm in TQ14. What I would say to anybody that's, these do not have to be questions that come in, they can be sort of comments, and the sort of Health Watch team will ensure that all feedback's recorded and it'll be fed back. So this is the comment from Malcolm. Moving services from Teignmouth to Dawlish will increase traffic along Bitton Park Road, which is already heavily polluted. Air pollution is already a major cause of health problems, and certainly, Malcolm, would anyone like to respond, or should we'll just note that as a comment? Okay, thank you. And again from Malcolm in TQ14, just follow-up question to the comment: who is providing the care in homes for the frail elderly, and how much time on average does a daily visit consist of? Liz. You may have knocked yourself off there, Liz.
That's the second time we have fines for that where I work. So just wanted to thank Malcolm for his question, because we've talked a lot, haven't we, about the importance of supporting people at home. And the needs of individuals are unique to them. So we work very closely with individuals and the people who look after them, their family, to make sure that we understand what's important to them. And we make sure that we put the right support around them. And that could be members of our intermediate care team who provide specific support, whether it's occupational therapists, physiotherapists or nurses. And likewise, it could be a member of social care staff providing support, including domiciliary care workers. The important thing is that is based around the individual needs of that person and what's important to them and how they best want to be supported in their own environment. So there's not one standard answer to that, Malcolm, but an importance of just recognising that everybody's needs are unique, and the multidisciplinary nature of the teams that we've got, including the voluntary sector that form part of the team we've talked a lot about today, have a role to play in supporting people at home.
Okay, thanks very much. I just wanted to mention that if you do hear banging, that's my neighbour having a new kitchen put in, so it's so that's what that one is. Right, interesting one from Sharon W. What learning from other health and wellbeing centres has been considered when pulling together the plans for Teignmouth and Dawlish? Liz.
Remembered this time, thank you. So thank you, Sharon, for your question. So this is something that we've been really keen to make sure that we learn from. In fact, I think David mentioned in his presentation that we've worked very closely with Plymouth University to make sure that at all steps of the process we've been evaluating the impact of health and wellbeing centres on the outcomes for people in our community, and I've made reference earlier to some of the things that's picked up in terms of more people being able to remain independent at home for longer, more people feeling positive about their health and wellbeing, and also an increase in people feeling able to manage their own health at home, all of which are important points of learning. And we share that learning across all of our community services. We have based out around 5 localities, and our 5 localities meet regularly to make sure that we share learning across all areas. And for some, those areas are just beginning to implement their health and wellbeing strategies with the development of their intermediate care teams, recognising that Teignmouth, or the coastal Teignmouth and Dawlish, were the first health and wellbeing team established in the trust.
Kevin, you're on mute there.
Yeah, sorry, buddy. I've just done that, but I'm just trying to sort of block out this incessant hammering from next door. Right. This one is from Joan Atkins. It's quite a specific question, so and it'll go to Liz. So we may not be able to answer this one. Right? It might be something that we've already discussed. So. Right, in order to offer the current site for the health centre, a bin store on this land used by shops in Northumberland Place has been closed, and apparently no alternative arrangements offered by Teambridge, so much is now being left on street. Is there likely to be any room for shared arrangements since, as we all know, no bins can be stored permanently on the highway? That's DCC policy. This is also compounded by all the bins that used to be in the Brunswick Street car park that have been ousted into Osmond's Lane to provide the site for the hospital, and now Osmond Lane is a bin store. Bin storage was a problem in the town centre and its environs before this development, and this is now being made far worse. The poor residents and shops are caught between the two conflicting council policies. Can you raise this with TDC, DCC, please? And this one's for you, Liz.
Thank you. And Joan, it's really important because it's these sort of things that make a real difference to how effective things are. So I think it's a really good point. I'm afraid I haven't got the absolute answer to it. But what I can say is that in the regular contact we have with the council, we will make sure that those concerns are raised. You will be aware that there'll be a planning process around the Health and Wellbeing Centre should the consultation conclude this is the right way forward. And again, there'll be lots of opportunity for local people to feedback around those particular issues at that point as well. And we are very happy to hear any other concerns that people have so that we can represent them in our conversations with the council. But an important point, and we'll make sure that it's raised. Thank you.
Yep, very important. Yep, that will be raised, John. Right, from Ray Ashman. Hi, Ray. What did the CCG lead? Why did the CCG lead local GPs in 2018 to believe that the construction of the Health and Wellbeing Centre in Teignmouth was dependent on funds from the sale of the Teignmouth Hospital site, which the CCG itself has since stated is not the case? Oh, Carly.
Well, I can answer the GP angle bit, and then I probably need to pass to Joe. I think probably I need to go back a little bit further in history. Back in 2016, as it was then, 4 GP practices in Teignmouth were successful in bidding for national monies, which is just over £1 million towards this Health and Wellbeing Centre. And over the period of time since then, there have been a considerable number of meetings, discussions and options discussed and developed, discussed and brought through to development, including options appraisals on site and obviously discussions about value for money. As you've heard now, the position where we are at the point of going to this consultation is, and I'm very pleased from my GP point of view, that the development of the Health and Wellbeing Centre is not dependent on the sale of Teignmouth Hospital. Can I pass that? I'm not sure whether both Joe and Liz would like to come in there.
Yeah, I think I can probably cover. Yes, yeah, so there's never. So I suppose it's a little bit in the phrasing, isn't it, in that question? So it was never the CCG never said that the construction of the Health and Wellbeing Centre was absolutely dependent on GPs being there, but it was always about the opportunity. And we've spent a long time, as Carly said, actually this goes back quite a few years now. We've been working together on what the potential was here, and it was always about what's the benefit to the population and what can we gain out of coming together and doing that together. So we could have done 2 completely different and separate solutions, and that would have absolutely been something that we would have done. But there was a want from primary care and also the services which Liz represents and the CCG to want to bring those together, because we know we will get better benefit for the population in terms of bringing those services together and integrating them.
Right, next one from Pauline. How many people who actually work and use the facilities in the hospital would actively want to move to the new centre or Dawlish if current facilities were brought up to date? Joe, back to you.
Yeah, thank you, Kevin. So yes, so as part of the engagement, we've not just part of the consultation, we've not just consulted with the public and with patients, but also with our staff as well. So far we've completed 3 staff feedback sessions. So all of that feedback is being collected again by Healthwatch, just in the same way as the public feedback is being taken, and that will be analysed and included within the report. Feedback so far has been really positive about the Health and Wellbeing Centre. So I think all of the staff, understandably, because they work in it, can see the benefits for the patients and for the staff actually in terms of being able to work more closely together. There have been concerns raised about car parking. As Liz, I think, mentioned earlier on, car parking is always an issue. Doesn't really matter where you are, but those concerns have been logged, and we will need to respond to that as part of the consultation.
Thank you. And this is a comment, but from Doreen. Doreen, what we will do is that Healthwatch will be logging your comment as you know, as part of the general feedback, but I think it's really important to read this one out in case it encourages other people to comment. And Doreen says that claiming that Teignmouth Hospital could not be used for coping with the longer term impacts of COVID seems expediently knee-jerk when the types of conditions that cannot yet be known due to their potentially chronic nature and could therefore require much more end-of-life care than could be supported in patients' own homes. That's a comment, I think, rather than a question, but Doreen will certainly sort of build that into the feedback. Thank you. And from Helen, can we celebrate the wonderful work that GPs and community nurses do to keep people safe and well at home, while acknowledging that having community hospital beds available locally adds to the safety and capacity of the whole care team, including resident carers, by giving an opportunity for respite, rehabilitation, intermediate and end-of-life care? And Liz, did you want to come back on this one?
Thank you, Kevin. And again, thank you, Helen, for your question, and particularly keen to echo your comments around the work that our clinical teams day in, day out, our GPs, community nurses, therapists and social care staff, the multidisciplinary teams also working very closely with the voluntary sector. In terms of the offer, we work very closely, as we've said, with people at home. But if somebody needs admission to hospital for acute care, and that acute care capacity is there, and we're confident that people will have an access to a bed should they need to do so. But the evidence is that when people recover from their immediate acute care needs, that they're better supported in their own homes by the multidisciplinary, multi-agency teams that we've been talking about today. So we need to strike the right balance by making sure that home first, we support people close to home, rapid access to a medical bed for acute care when needed, but support for people to return home with the right level of support as soon as they're able to do so. And that is very much at the centre of what we've been talking about today. Hopefully that helps answer your question.
Right, thank you very much. Now, we were going to finish dead on 1 o'clock. However, we started a few minutes late, so if we need a little bit more time and there are any questions, I've just had a question come in, which is terrific. Right, and this one's from Pauline, who says, if you are definitely not going to put the beds back, why not rename the hospital as Teignmouth Health and Wellbeing Centre, spend the 3 million or so there and look for new premises for Channel View practice? Joe, this one's for you.
Yeah, thank you, Kevin. I think, to be honest, I think I've probably already answered this, to be honest. So first of all, it's not just about the money. So I think we've been really clear about that. There's a whole set of criteria that we need to assess options against. We would still need to have a GP practice. We still need to find a new building for that. We still need to make sure that the building and premises we've got for the community clinics is fit for purpose. We still want to work with the voluntary sector. So I don't think there's any, in terms of assessing whether that would be better value for money or cost us more or less, I don't think we know that it would be cheaper in any way. But what we do know is we would lose the benefit of bringing all of those services together for the local population. I think that's probably the most important bit. And Liz wants to come in as well.
Please. Yeah.
I suppose the other thing I'd add, and I think we've talked about it as well, is making sure that the clinical rooms are designed to and fit for purpose for the care that we deliver now. And we know that not only are we having to think about now, but also our longer term future. So, our responsibility has to be to make sure that we're using that money in a way that's going to be as effective for as long as possible, which is another reason why the investment in the Health and Wellbeing Centre feels like the right thing to do.
Thank you. And Carly.
I was just going to add one other comment, is when we had the public engagement, which I took part in along with many others, there was my recall from that, and I think it would be backed up by the documents that the CCG now have, is that the public had a very strong feeling that the Health and Wellbeing Centre would be better placed in the centre of town, in the flat area. And we've mentioned the slight concern about flooding, which I'm sitting here in my surgery now, right by the sea, so in the flat area in town. But the GP surgery is already in the centre of town, and I would personally be concerned about moving ourselves out of the centre of town and making access to GP services, which have a very high footfall, both for GPs and for nurse appointments, into an area that is up a hill and with less good public transport. But the public were very keen that this development was in the centre of town, and I think we do need to listen to the public on this.
Thank you. And I think this is going to be the final question, and it's from Malcolm from TQ14. Straightforward question. Will the Health and Wellbeing Centre be funded using private finance initiative? That's also called PFI, I think. So, Liz.
Thank you, Malcolm, for that question. So just to clarify, the trust will hold their overall lease of the property, and will be putting just about 1.4 million in alongside the 1 million I think Carly made reference to earlier, and that will form the basis of the funding. We will be working with our strategic estates partners to secure the balance of that investment, and the expectation is that it will be in full NHS ownership within 30 years, with the trust holding the lease over that 30-year period. So it's owned and held by the trust.
Thank you very much. We're just about to close now, and the final one comes in from Ray Ashman. Hi Ray, which is really nice. Can I say thank you to the panel for addressing our questions? You are obviously very dedicated professionals, but you do seem to have been given a role passing off cuts and services as better care that cannot sit happily with you as the caring professionals you all seem to be. Can we hear what you really think for 2 minutes? And I think this is a really good opportunity to close the session and just to go through the panel and just respond to Ray's comments there. So who would like to go first? Joe?
Yeah, happy to kick off. Thank you, Kevin. Yeah, and thank you, Ray. I appreciate that comment. I think you know, as you'd expect, really, we all work for the health service because we care about health services locally. We care about the population. We wouldn't be able to do this job if we didn't and weren't passionate about it. So my role working for commissioning is to make sure that we've got the best quality services we possibly can for our population now and for the future. So I suppose, you know, it's my job to make sure that we've got services that are fit for the future and that we can afford those services and make the best use out of the money we've got. So everything that we do or I do works towards that aim. And so I truly believe, and I've heard and listened to the clinicians and listened to what they say about this model of care, that that's the right thing to do. And just in terms of cuts, I think hopefully what you've heard today is actually this is a significant investment in services. So this isn't about cutting services, but it's actually about investing for the future.
Thank you there, Joe. And Liz, do you want to come in?
Thank you, and thank you, Ray. And I also just want to acknowledge the commitment of our staff, our clinical operational staff across health and care, who are really dedicated to do the right thing for their community. My background, I used to be an occupational therapist, and as an occupational therapist, I have really learnt the importance of supporting people to do what's right for them, what's important to them. And I've listened to people who use our services. I listen to clinical staff. I look at the evidence emerging from things like the survey, the investigations that have been done by Plymouth University. And what that's telling me is that is delivering improved services for people in our community that are different from the services that we had before, absolutely, but they're delivering good outcomes for people, enabling people to have the things that are important in their lives. And that's what kind of keeps me focused, is making sure that we use the resources in the best possible way so people can have the lives that are important to them. And that's really what drives me. And I have to ask, if we had more money, would I be arguing for a different approach to delivering care? And I don't believe I would do. I think this is about delivering something that is aimed at kind of enabling people to have the lives they want in the homes they have for as long as they possibly can do. But thank you for your question. It's really appreciated.
Thank you. And Carly.
I suppose I answer this in two ways, two halves of me. One as a GP seeing patients day in, day out in my surgery, and another one as with more of a strategic view and stepping back. And in both, I would say this isn't my perception as a local GP this isn't about cuts. This is about developing a new and better ways of working. The health and wellbeing team that we've been talking about, the intermediate care team it's been referred to, since its inception has had more impact on more of my patients for benefit than I could ever have delivered by looking after a patient in Teignmouth Hospital. And as a GP in the area for a very long time, I've looked after lots and lots of people in Teignmouth Hospital, but there's a finite number of beds there when it was in its previous incarnation as a community hospital. So I've been really impressed by how the health and wellbeing team and health and social care team have reached so many patients in the community and looked after people. And this isn't just about Teignmouth, it's about Teignmouth and Dawlish services. So that's the answer from that bit. From a purely GP perspective, I'm bound to tell you that I think GP services, I'm passionate about GP services being sustainable and developing for the future needs of the population. And COVID has taught us we have to keep changing. We've had to be flexible in how we've worked. We won't go back to how it was 10 years ago or how it was a year ago. And we have to keep on developing and changing as needs change. But it is absolutely vital for the health and well-being of the population of Teignmouth and Dawlish that we have strong, efficient GP services in fit buildings that are fit for purpose, and that we work as broader teams. So I'm completely behind this proposal.
Thank you very much, everybody. That's terrific. And unfortunately, we can't go to Dr. Greenwell because we've got some sort of technical issues, but I'm sure he'd echo those comments. And that's pretty much it. So we've reached the end of today's meeting. I'd like to thank everybody who's taken the time to tune in. So I'd like to thank my panel. Thank you very much for those answers. And I'd also like to thank residents and elected members and everybody else that's tuned in today. So that's my personal thanks on that one. I hope you found it interesting and useful in coming to a view about the proposal. And also share your views with us. And there's lots of ways of doing that. I think it's on your screen at the moment. So we've sent the document out to 16,000 households in Teignmouth and Dawlish, and thousands more leaflets have actually gone out. I've spent a lot of the last 2 weeks mailing out consultation documents and dropping them off at community centres and community groups, and I think I've got to drop some off at the Kingsway Community Centre tomorrow. So please fill in the survey online or the consultation document, and let your community groups know that we're out here trying to respond to those questions. Join those online meetings. There's one more of these similar formats that is going to go out, and that's on Saturday the 17th of October at 11 o'clock. It'll be very much the same format, but if there's anything that you want raised, anything that's sort of an issue, just come back and join that one as well. Or you can request a telephone call if you haven't got access to the internet, and my Health Watch staff and volunteers will be there to try and sort of help out on filling those forms in. And finally, oh yes, I did mention earlier that we'd like to think about how you think these kind of format of meetings actually go. So there will be a link to a short survey in the chat box. So it'd be really grateful if you could fill that in. And that's on the consultation meetings pages of the website. So finally, as I said, thank you very much for being involved. Thanks to everybody. Have a wonderful day, and I'll look forward to meeting a lot of you face to face at some time. So thank you very much, everybody.
Thank you
Bye-bye.
very much, everyone. Bye.
Thank you.